Over 40 million women in the United States of America use Medicaid, and 700,000 in the state of Washington take advantage of it. So yes, we're here to fight with our other female colleagues to say now is not the time to write a new health care bill in the dark, making sure that we are unable to communicate the details of the health care cuts that so many Americans would face if they are successful in passing this legislation. Like Senator Duckworth, I too would like to focus on a veteran that I just recently met, a woman named Christina, who served our country honorably in the U.S. Navy. She worked as a health care worker as part of the system and suffered some chronic injuries that make her subject to Medicaid to fill the gaps that the VA cannot do. Christina is also a full-time student, and as she would say, Medicaid keeps her alive and keeps her in school. So it's very frustrating to hear that both the House bill and the cuts to Medicaid could result in 56,000 veterans in the state of Washington losing benefits, or 1 million veterans nationwide losing their access to health care. We promised our veterans that we would take care of them if they helped take care of us. And now is not the time to cut these vital services for both men and women who have served our country. We need to live up to the obligation to people like Christina, who served us and served our country, and make sure that she can continue her education and get the health care that she deserves. Like Senator Duckworth, like Christina, these are promises that we need to keep. I ask our colleagues to come out of the dark and make sure that they are communicating what their plans are to the American people. And we'd ask you to help us, to help the women of the Senate fight to make sure that health care is provided to everyone.